Hello, Vasi.
This 1 second, 1 second, 1 second.
Hi, Jens.
How are you?
Fine. How are you doing?
Well, thanks. Well, thanks. So
Vasi,
I was wondering
our BBC star.
No, but thanks for that email. Yeah. Anyway, we chat again just now. I just got somebody on the call. I'll chat with you now, Maaza.
Okay. Okay. Hi, Kavengo. Jens is being quiet. Hi, Kavengo. Can you hear us?
Hey, Maaza.
Hi, Jens. Hi, Jens. I know I've just seen your message that you need to hop off at 3:20. Kavengo, I'm glad you joined us. I got the message saying that you maybe couldn't, so I'm glad you're here.
Yes, the meeting was postponed. Thank you very much.
Oh, excellent. Welcome, welcome.
Okay.
Hi, Onesmus. Karibu sana.
Hi, Maaza. How are you today?
Fine. How are you doing?
I'm good.
Excellent. Let's just give people 3 more minutes.
Okay.
I'm going to turn off my video because I see I don't need to be the only one here.
Yeah, I would have turned on my video, but my camera worked up on me. So whenever I try to turn my video, it tells me that your video is not accessible.
Don't worry. Not necessary at all. Hi, Belinda. Welcome.
Hello.
Hi, Belinda.
Hi, everyone.
Welcome, welcome.
Thank you.
We'll just give people 2 more minutes.
Okay. I got too tied up. I nearly forgot about it. Now I just saw, oh my word, I'm late.
That's okay. Hey, Anand.
Hey there, good to see you.
How are you doing? Welcome, welcome.
Thank you.
I won't leave you hanging on your own. I'll turn on my video for you so you're not just hanging on your own, but if you would like to save bandwidth, let me know and I'm happy to. We can do a videoless call. I'm just going to drop the agenda in the chat here. Hi, Charles.
Hi, everyone. Apologies for being late.
That's okay. We're going to give people 1 more minute. I've just dropped the agenda into the chat. We're going to move some of these things around because I know that some of you, I've already received a couple of messages. Tian, I know you have to hop off a little bit early. Tian, do you have a sense of when you will need to hop off for this other meeting?
No, I'm just waiting to be summoned to the session.
Okay, okay. All right, so it is 5 past and we are recording. Hi, Joab, welcome, welcome, welcome. I would love it. Thank you everybody for joining and Happy New Year. I hope everyone survived the holiday season. Hi, Jens. Jackie, since most people here don't know you, I would love it if you just introduced yourself, Jackie. I put you on the spot. Jackie's our new African Alliance colleague.
Yes, indeed, Maaza. I'm here frantically just trying to make sure that I don't miss anything, so forgive me. I'll switch on my video. Hello, everybody. Yes, my name is Jackie. I have recently joined the African Alliance. as admin coordinator, and around this work, been really working closely with Maaza. And yeah, I'm looking forward to this first PVA Africa meeting and having a great sense of what actually happens in the meeting. Thank you very much.
Great.
Welcome, welcome, Jackie.
Thank you, Jackie. All right, and we won't go through and do an intro of all of us because most of us know each other, and I know that there are a few of you who need to hop off, so we'll just jump right in. I put the agenda into the chat, but I can briefly share screen with everybody because I have a few. Can you see my screen? Hello, can everybody see my screen?
Maaza, we can see it.
Yes.
We can see it.
Okay, great. First of all, Vasi, now that I've heard your voice again, I have to say, I don't know if everybody heard the BBC program that Vasi ended up getting onto in the end. And there was a Dutch man when Vasi asked him if he supported the TRIPS waiver, said that he loves Africans too much to want them to be vaccinated because he was an anti-vaxxer, which I thought was, Vasi, how you didn't burst out into peals of laughter, I'm not sure, but thank you for doing that. Do you have any comments about that BBC experience before we jump in, Vasi?
No, I think, Maaza, I must thank you actually for that email. And I had responded to the question they asked me was on compulsory vaccination. In 100 words, we have to say something. And I just sent my response. And the next thing I got a call from them. They said they liked the response. We had a bit of a chat. And then he asked me about the TRIPS. Well, he spoke about the patient and I spoke. No, I actually told him about the TRIPS waiver. I said, and then he said, like, what is TRIPS? And then I was explaining to him. And he said, oh, you mean the patent waiver? I said, yes. I said, why are they holding back on that? Because you wanted to know if South Africa had accessible and available vaccines. I said, yes, we have, but we have vaccine hesitancy. And that's why our numbers are not high. And I said, but we have, but the other African countries don't have. And then I went on to the TRIPS waiver. So then he sent me an email after this to ask me whether I'd want to be on this BBC thing. And then the rest is history. And yeah, but the only thing I felt disappointed, we didn't get enough time to be able to do a full response. And the lady was a bit faint, the Agnes, but luckily I picked up the voluntary and the compulsory licenses because they are two completely different. And if you look right now, India has got a voluntary license for the treatment of COVID, which is an antiviral drug. But now our country, they probably going to register the drug as well, but we definitely would have to still import it. So she was talking about vaccine being so little money and all, which is true. But what they are not understanding is that they were funded by the government for these vaccines. And secondly, we need the transfer of technology because South Africa is now this new initiative, which will take us about 2 or 3 years to develop our own vaccine because we don't have the technology. So we have to start from scratch. So we are asking them for things like that, but they're not budging, you see. So it's sad that they're measuring their profits against human lives. And that's what the point I wanted to get across to them. And I think I managed to get that, yeah.
Yes,
Thanks.
You did. Thank you. And thank you for jumping in to do that. I really appreciate it. So everybody, I have put the detailed agenda in the chat. So please have a look at it. For those of you who need to hop off early, if there is an item that you're thinking, oh gosh, please, can we discuss this before I leave? Please let me know. But our thinking for today was to give you a sense of where the PVA stands globally because of the current state of affairs and Omicron in the last few months. PVA is revamping its manifesto a little bit. And I wanted to just give you all feedback on that. We also wanted to hear about your updates from around the continent. In your various countries, what is the current climate around COVID, around Omicron, around vaccine hesitancy, et cetera, just so we can also feed into the PVA global strategy. I wanted to give you an update, Tian and I did, on PVA Africa generally. We wanted to talk to you about the funding situation, which we've been speaking about for a while, to talk about the steering group, which we have very happily set up, to talk about the steering group nomination process for alternates. Jackie wants to make sure she has all the current information for all of you, so we want to go through that. And then also talk a little bit about staffing issues at PVA Africa. And then I wanted to quickly go through upcoming dates in Q1 of 2022, the ones that are on the PVA global calendar, and then also to find out from you, are there any dates that are not on the PVA global calendar, which we should be adding? In terms of any other business, I've had one request from PVA Global to discuss the issue of the pharmaceutical company meetings at Africa CDC, and to see what our sense is as PVA Africa and as African civil society about these meetings, and if we want to give any feedback around that. So I can hear somebody. If you can mute yourself, please, that would be ideal. And that I did get a couple of people write to me and say that they were not going to be able to make it today to this meeting because the Johnson & Johnson seminar was actually taking place today at Africa CDC. So those are the meetings that I'm talking about, the Johnson & Johnson one and the Moderna one. And just if there is a sense that we want to give any feedback on that. So that is kind of the detailed agenda for today. The call is supposed to last until 4:30 South Africa time. I just want to give, is there anything that people you already want to tell me, gosh, I have to leave, I would like to talk about this. Tian, I know that I'm going to move some things around just to accommodate you. Is there anything that people would like to add in any other business or anything that should be moved around from your perspective?
Maaza, you've mentioned something in the chat, but I'm not seeing it. Maybe if you could repost the link.
Aha, okay, hold on one second. Tian, can you do me a favor and just I think it's because Anand joined after I had posted. If you could repost in the chat, Tian, just copy and paste.
Great, thank you.
Thanks, Tian. Any other business that I can add from anyone, please? No? Okay, if not, I will go ahead. So just a reminder, you all know this, what the PVA is. It is growing in the last few months.
The Abuja meeting.
Sorry? Oh, you want to talk about the Abuja meeting? Yes. Okay, great.
No, Maaza, I'm saying, I think Anand, sorry, my line is bad. I think Anand is referring to the comment I had put for you to put into the key dates before the meeting started. So there's no link for that at the moment.
Okay, there's no link, but Anand, can you see the agenda, by the way? Can you see the agenda that I had, the detailed agenda that's in the chat?
No, I can't. It's okay though. Do carry on.
Okay, Tian, if you can see the detailed agenda, please just copy it and repaste it so people have access to it. All right, so this is the PVA's demands that are at the moment being a little bit tweaked in the face of the current situation. And the current situation, and I would really love to hear your thoughts from your countries. Okay, hold on one second. I realize that there's actually nothing in the chat here. Oh, I see what happened is for some reason I did it just for waiting room participants. I don't even know that there was an option to do that. I'm sorry, everyone. So everyone in the meeting, I hope that comes through now for everyone.
Great, I can see it now. Thanks, Maaza.
Okay, great. So the feedback that we've gotten from PVA Global is that there are quite a few government leaders, scientists, pharma reps saying that with Omicron being weaker than the previous variants that we have seen, that the pandemic is sort of fizzling out. So that's one sense that we're getting. Two is that given that Omicron is not as virulent or is not as dangerous, or it's very contagious, but doesn't make people as sick, that in a lot of first world countries or richer countries where people are boosted, the level of interest in COVID is sort of waning. And as well, the pharmaceutical companies starting to say that really the ramp up for Africa and other low and middle income countries has been going very well. So the kind of urgency around COVID is sort of waning. Then there's another group of scientists who are saying that there's no evidence that the next variant will be weaker than this one. So there's a little bit of back and forth with PVA trying to figure out how to re-strategize, how to make sure that issues of treatment and testing are included very clearly in the manifesto and the strategy. There was a strategy meeting in December of last year with some kind of key events that the People's Vaccine Alliance wants to tap into for the coming year. But there is a sense of some people saying that the urgency around dealing with COVID and around the discussion about vaccine apartheid has sort of lessened or should lessen given Omicron and the fact that people are not dying at the same rates. So that's sort of what PVA is grappling with at the moment. I would like to open it up a little bit for discussion with you all to see what your thoughts are about that. And I will turn this off for now, just so I can, if there's anybody who wants to chime in. That is currently the situation at PVA Global, reviewing the 5-point manifesto, making sure that issues of treatment and also of testing are included, and kind of making sure that the messaging around, the next variant will definitely be weaker, that is really looked at critically, because there are other scientists that are telling us that is not the case. So any thoughts from your countries, anything that you would like to make sure, Jens, please go ahead, that we can include in the PVA manifesto revamp going forward. Yes, Jens.
Maaza. I think it's important to include focus on pandemic preparedness. If there's an issue that, and this goes back to the structures and the inequality from an African perspective that we've seen enlarged now, played out during Ebola in 2014-16 as well. And it's only manifested and escalated since then. The waiver, the argument for manufacturing is as prepared and having the ability. Nothing changes, which nothing has changed, we will not be. So I think perhaps strategically to add that as a weight on the argument around, because we are now faced with, as you say, the argument which is, well, there's no urgency anymore. So essentially industry and policymakers in the North and West are saying, well, why are you moaning? There's no urgency anymore. We are still interested in the structural change for the fact of being prepared and being able to respond adequately for the next pandemic. Now, sort of in some terms, that's taken place with the conversation, slow and perhaps futile as they are, around the pandemic treaty that will unfold in the coming year in particular. So there is normative conversations around changing some of the landscape, not for COVID, but for the next pandemic. And we need to include that focus in some of our COVID-19 and vaccine-related messaging as well. Thanks.
Okay, great. Thank you, Jens. And I see that there are some other hands that have popped up. One other thing that I wanted to mention that the PVA is also grappling with is the Human Rights Watch report that was released recently, where they went through and looked at manufacturers around the world who were ready to take on mRNA vaccine production. We had a call, for those of you who are members of the PVA, I see Charles here. Charles, I don't know if you were on that PVA Global call the other day, but there was somebody from who worked on that Human Rights Watch, and Jens, this was actually an MSF person as well, was there. Alain, I forget his last name, talking about this voluntary licensing and these pharmaceutical companies that are ready to maybe just give individual self-controlled fill and finish type licenses. And he was saying to the PVA that would the PVA like to consider maybe shifting away slightly from the TRIPS waiver and focusing more on this voluntary licensing. And there was quite a bit of pushback and confusion around that. He was saying that that's going to go faster, the TRIPS waiver is going to take a long time. And Jens, some of the PVA group was saying, if we want to plan for the future, the TRIPS waiver is really critical. And this idea of leaving it to voluntary, where the companies themselves still kind of like as a franchise control everything, is not the way we want to go in terms of preparedness for future pandemics. So that's also something that's on people's minds. I just wanted to let people know. Anand, I think you were next, and then Onesimus and Belinda.
Sure, thank you, Maaza. The thing that I feel kind of needs to be beyond this as well is to do with local hesitancy and constraints. So I've spoken and written about this before. What we're seeing in Kenya is we've now got as many vaccines as we've used, but the problem is about hesitancy and local issues. What I expect to see in the coming months is that we'll get to about 30% vaccinated, and then we'll hit a wall, and the government won't be able to get further than that because it's not really putting in the resources. And I expect that same pattern may happen in other countries. So I think it's a little bit in expanding public health systems, the bottom left demand on that slide. But I have a fear that we'll get to a point quite quickly where, you know, other continents are fairly well vaccinated. The vaccines arrive here, but people aren't using them. And that will also sabotage some of the public health concerns. So it's just something I feel needs more attention. And it's a little tricky because the focus of the campaign has been very external. It's been to do with global injustice, but what I'm seeing more and more is local injustice. So the people in the cities in Kenya have got vaccinated, they're chasing boosters. They don't care very much about the other things. And the government's basically waiting for aid agencies to do this work. And there isn't public demand or even concern now. So that might become a growing issue. And I think you may be able to use, if there are ways of dealing with this hesitancy, but not many people are really working on that. Joab and I have talked a bit about this, and there's ways of doing those kind of public health campaigns, but they're not really happening. So there's a gap there, and you may be able to go to the vaccine companies and say, look, you know, we'll actually be able to bring more people to the table, and that gives us some leverage because nobody else is going to be able to solve that. So that's something I'm still concerned about.
Okay, thank you. And Tian, maybe once we hear from Belinda and Onesimus, you can sort of respond to Anand's concerns with your work on AVDA, and I know that you're involved in the ports to arms discussion. So Anand, I hope we can get to that. Okay, thank you. Onesimus, I think you were up next.
Thank you very much. Thank you very much, Maaza. And I think Anand kind of preempted my thoughts. I think where we are headed to, we need really to start thinking of putting substantial investments in demand creation for vaccines, because like Anand said, we are likely to be hitting kind of the roof at a very low percentage, where you see people who have actually received vaccines are much more ready to go for boosters, first booster, second booster, but people who have actually not gone for vaccines actually are hesitating to actually go for vaccines. So we are likely to begin seeing a scenario where you're having a country vaccinating 25%, 30%, probably 40%, but then you start already hitting a ceiling that you really can't kind of break through. You may actually have the commodities around, but then there's no sufficient actually demand on the ground for people coming for the commodities. So I think it's time that we also kind of match the investment and the efforts we are making on ensuring that commodities are available and delivered the same way we invest enough to ensure that there is sufficient demand for these commodities, so that as they come in, the uptake equally is fast. So I think that that's something I really think is something that needs to be to receive a share of focus. Thank you.
Great, thank you, Onesimus. Belinda.
Hi everyone. Hi, thank you, Maaza. I just want to ask this question: if if this is a fact or a myth that the Omicron was first detected in USA before it was found in South Africa, because it was firstly said South Africa was the first people who brought this awareness to the face that Omicron was found here by us. And that is why we had so much hesitance in people going for the shots that has been or is available now for the people. So I just want to know, is it a fact? Is it a myth?
What
USA were the first people, and it was kept silent. Nobody knew about it. It's only now very recently that it's been found out that it was, they were the first people with the virus, with the variant.
So and I look, to others to chime in as well, but what I have heard is that it was first identified and the information was shared in Southern Africa, but some evidence shows that the first cases were actually in Europe rather than the US. I don't know if those of you who have been tracking this more carefully than I have anything to add. Anand, I see you've put your camera on.
Yeah, I think there are some suggestions that Europe may have had cases for longer. I haven't heard about the US, Belinda. So I think that sounds like rumors that somebody is spreading to create hesitancy. I would be skeptical of that.
Does anybody else have anything to add about Belinda's question before we move on to Vasi? I saw you just put your hand up. Were you responding to Belinda's question?
Yes, Maaza, thank you. Yeah, I think that the problem here was that even if they were infected with the Omicron strain, but they did not do the testing in the lab. But what South Africa did, they were monitoring very closely. And when this, well, actually it was a SAMA chairperson, when she had a first set of patients and the way the symptoms were coming through, it didn't quite fit the exact, picture, because it was more upper respiratory to the actual Delta. And so that's when I think they had actually requested for trying to test or screen the virus to see what it really was. And then of course it was done here at KZN at Kairat buildings. And so then they realized that Prof. Olivier, that this is definitely not the same. There was mutation seen, and then they realized that we have a new strain. So maybe it could have been throughout the world for all I know, but no one actually went and thought that this could be another variant of the virus. And I think that's where the problem, and now that people are starting to get more information about it, and maybe this is the story we are hearing, that it's probably happens elsewhere as well. Thanks.
Okay, thank you, Vasi and Anand. Belinda, I hope that answers your question. It was first identified in Southern Africa, but it's not entirely clear where the first cases are, and there's some evidence that it could have been in Europe. I hope that answers your question.
Thank you very much, colleagues. It is very important for us, as we need to educate the people to go for the vaccine and the second booster, if there is. So like fake news sounds very, very real. And we're working with people in the rural areas, and it's not always easy to get them understand, you know, they don't know the difference between fake and the real thing. So sometimes we ourselves who are out in the field, they get confused with it. So it's important for us to know.
I wonder if I can come in again. Belinda, one of the things that's happening is that new variants are being detected almost every week. And it might be good when you're talking to people to say, like, this is happening all the time. There are always new variants being detected all around the world. This one became more important, but it's another reason to encourage people to get vaccinated, because these things are changing all the time. So I would take the conversation away from where was this one first identified to broaden it to say that the virus will keep mutating unless, and we need all the protection we can get.
Okay, thanks, Anand. And Belinda, I know that maybe Tian, you can speak a little bit about this when we come to you after Charles and that ports to arms discussion. I'm guessing that there is quite a bit about hesitancy and messaging. So we'll let you speak a little bit about that. Charles, you had something that you wanted to add?
Yes, thanks, Maaza. I think I agree with what everyone else has said. In the slide you put up, outcome 5 was sort of scale up sustainable investment in public health systems. And the one thing I would like to flag underneath that, perhaps the Global Vaccine Alliance can develop some messaging around that, is sort of the human resources behind that. So nurses, doctors, and particularly the inequity, the global inequity we're starting to see with rich countries sort of poaching foreign nurses due to sort of, obviously they've sort of mismanaged their own internal pandemics. There's lots of nurses and staff who are leaving the system, a lot of burnout, and their only sort of resource is staff from poor countries and low and middle income countries. So I think that's something we're gonna see a little bit more and more of, and it'd be good to sort of try and develop some messaging and get that on the agenda. Thanks.
Okay, thank you, Charles. Tian, we have a point here on the agenda just about kind of the status of vaccine rollout. I think everybody knows that Tian also sits at the African Vaccine Delivery Alliance and has been involved in many of these discussions over the last 6 months. So Tian, anything you can give us in terms of the status of rollout and any discussions addressing what we've spoken about today in terms of staffing, pandemic preparedness, hesitancy issues?
Thanks, Maaza. I think the first just a comment around Omicron. You know, as Belinda was speaking, it reminded me, and I think as Anand also reflected, that it would be, it might be strategic for us as community organizations to continuously encourage conversations around why vaccination is important. And I guess it's a fine line, right? Because you also don't want to be dismissive of communities who genuinely have questions around where this virus came from. But I'm just comparing it to the early days in HIV. You know, there was a lot of, where did it come from? Where did it come from? You know, is this Europe's way of wiping out the Africans? Is this population control? Is this monkeys? Is it mice? You know, what is this? And so I think we can, you know, just reinforce communities' understanding that variants are 10 to the dozen. It's not the first, it's not going to be the last. If current rates continue, there'll likely be yet another, you know, very deadly variant. In terms of the current one, I mean, there's a range of theories, you know, from it having circulated in a population with little surveillance. It could have gestated in a chronically infected COVID-19 patient. There's stories about the mouse theory. There was a paper published, I think, in Science or Science Direct around the mouse theory. So I think in order to avoid taking communities down that rabbit hole, in the absence of clear, defined, peer-reviewed evidence around its origins, I think we should keep on steering the conversation back to vaccination. Here, at least in South Africa, there's been a lot of talk about the vaccines affecting menstrual cycles. The Commission for Gender Equality issued a really horrible statement, essentially condemning vaccines.
Tian, I have lost you after condemning vaccines. You said they issued a horrible statement condemning vaccines, and then I lost you.
Oh, yes. Thanks, Maaza, which a group of eminent scientists have basically condemned. So for those of you not in South Africa, I imagine this discussion will come up in your countries sooner or later around potential effects of vaccines and menstrual cycles. In terms of the African work, we had our last ABDA meeting, our last major ABDA meeting in December and another one in January, but in effect, the conversations are really focused on issues of shelf life, the standards that we really have to keep on pushing, and COVAX needs to keep on pushing, as does AVAT, around when these vaccines come, concerns around short life, despite the fact that there are already standards and principles that donors must commit to in terms of how they improve the quality and predictability to reduce these transaction costs, and making sure that when the vaccines come, there should be a minimum shelf life of at least 10 weeks.
Tian, you're spotty again. We lost you after 10 weeks.
Sorry, Mother, my line is terrible.
Yeah, we lost you after 10 weeks. If you can just start from that point.
So there'll be continued advocacy in 2022 to ensure we pay attention to shelf life. Lastly, there was a 3-day retreat that was really looking at this new, yes, colleagues, because we clearly don't have enough, a new global facility called a global vaccine delivery facility that is being set up, headed by COVAX, Gavi, WHO, UNICEF, ABDA, ACT Accelerator. And really at the essence of it is what we want to achieve is we want to achieve highly targeted, thoroughly resourced, politically powered interventions at national and country, well, at national level. So what you will see in the next few weeks is this body that will articulate how we have identified these priority countries and what support will be provided with.
Tian, we lost you again. You said priority countries and what support will be provided.
Yes, the priority countries and what support will be provided at that country level. Of course, it's really focused on strengthening country level support, unlocking those bottlenecks and accelerating progress towards the various targets, and increasing amount of political visibility and support for vaccination programs. At national level, there's a stream on specialized TA and surge support. There'll be a whole stream of work supporting existing data metrics and monitoring work. There will be an analysis of delivery funding and what delivery funding looks like at country level, as well as some demand planning and of course a communication stream. We of course advocated throughout those 3 days to ensure that national civil society is engaged at every single step of this structure. So we'll be sure to share more information and updates as that rolls out. Of course, the Ports to Arms program rolls out in Malawi, Rwanda, and Zambia in February, and this is using models of accountability to ensure that we measure in real time how doses are getting from ports to arms. Apologies for my line, but I think that's an update from me, and happy to include whatever the line didn't allow me to say in the report that will be shared. Thanks, Maaza.
Okay, thank you. And Tian, you mentioned that that new facility, the COVAX Gavi UNICEF accelerator, had picked priority countries. Do you already know what those priority countries are in Africa?
So that work is currently underway. As with all of these things, it's a very tight timeline. So within a week and a half, there'll be a clear idea of what are the priority countries, because of course a matrix is being developed that will allow the collective to determine those priority countries. Just a reflection from me, a country that repeatedly came up as a glaring current need is DRC. Then of course we have the group of countries that we're working with that are currently facing instability. Chad, Niger, Central African Republic, etc., etc. Of course, we've seen developments now in a few other African countries around political leadership, so all of those will fall onto the radar for prioritized support. I mean, it's not ideal that we're limiting to prioritized countries, but I think it's realistic and it's pragmatic. There's a limited amount of resources to go around, and I think we have to put the resources, the time, the focus, and the TA on priority countries, bearing in mind there are some countries on this continent that have largely been untouched by a vaccination program. And so that just has to be the priority for the current global delivery mechanism.
Okay, excellent. That's super helpful, Tian. Thank you. Any quick questions for Tian on that before I move on to the next section of the agenda on PVA Africa? Okay, so in that case, we will move on. We also wanted to give you an update on the situation at PVA Africa. As you all know, the African Alliance has been leading and continues to lead the work of the People's Vaccine Alliance in Africa. We have spoken for a few months now about the funding for the entire duration or the life of the People's Vaccine Alliance. All of the work that has been done around the world, aside from 2 positions, has been essentially on a volunteer basis. Organizations like the African Alliances or others really just chipping in time to support the work of this alliance. In the last few months, I would say in the last 6 months or so, the PVA has gotten attention from a few foundations. At the moment, all US foundations, I think, unless Tian, do you know if Wellspring is in the UK or are they also in the US? They're in the US, right? Yeah, your line, I just lost you. But yes, so basically a few US foundations have expressed interest in supporting the People's Vaccine Alliance, the work around the world. So there is some funding that has finally come in, and we're hoping it actually, and Tian has just briefed me, it hasn't physically come into the different bank accounts, but it has at least been committed. So some of that is to cover staff time, and quite a bit of it is to cover activities, campaigns, materials, etc., in the Global South countries that the People's Vaccine Alliance supports. For that reason, and also just to kind of guide the feedback from Africa to the People's Vaccine Alliance, we have spoken for a few months about the fact that we wanted to develop a PVA Africa steering group. So I'm happy to say that the primary members of that steering group have accepted our invitation. And Tian, if you could talk a little bit about, the individuals and the organizations that they represent that we've selected who have accepted our invitation for the PVA Africa steering group. And once Tian has done that, I will also talk about the nomination process for alternates, because for each of these people, we also do want a fully briefed and active and engaged alternate. that can fill in at short notice, representing the various regions that the primaries represent, but also would be available to potentially step in as a primary if the initial person was not able to continue. So Tian, while you give a briefing on the individuals that have very, very generously offered to be part of it or agreed to be members of the steering group, I will put the slide up on the screen.
Thanks so much, Maaza. Yeah, I'll be very brief, but just short to say that we used an approach spectacular in terms of their generosity of time and spirit and leadership. These are all civil society leaders who have been at the forefront of a range of health responses over many, many years. You know, you're speaking about Rosé Ekhtasadi from SAF-AIDS. SAF-AIDS is a really powerful regional organization across Southern Africa that works to advance a range of health rights issues. You've got Lawrence Kabasele from out of the DRC, who really has provided amazing leadership to this young, dynamic network of young people working to advance health access. Florita out of Nigeria from NAVMAS, a long history that organization has of working for not only justice around COVID and HIV, but especially development of new products and what that looks like in terms of the marketplace. They've done work from back in the day, I can remember over a decade ago, around rectal microbicides, vaginal microbicides, HIV vaccines. So a really powerful partner there coming out of West Africa. Of course, from East Africa, we have our longtime friend and leader, who's also on the call now, Onesmas, who again, very generously has agreed to provide us time, expertise to build what this inaugural steering group will be. You remember Ianaso, of course, has a really prominent current role in terms of making sure that communities are brought along within the pandemic response, and has a long history and equally diverse range of historical and current funding partners, which I think is testament to the impact that they deliver across the continent. And of course, from North Africa, Sophia, who is also on this call, from Jamaiti, really a hub based out of Tunisia that really serves as a central gathering point and information portal for civil society in Tunisia and indeed across that region to really come together and receive support, whether it's technical support, access to information, materials, opportunities, etc. And of course, we have the really humbling honor of facilitating this space. So it's just left for me to say just deep, deep appreciation and thank you to all of these initial steering group members. I think Maaza has captured perfectly our intention with the alternates. We want to make the circle bigger, and we want to ensure that alternate steering group members will also be kept in the loop. So essentially there will be two individuals from each region who will always be in the loop and have a current and working knowledge of the decisions and the discussions that are happening within the steering group. And as Maaza said, another role of the steering group, of course, will be to at least provide some kind of accountability mechanism when we begin to attract the funding. I see a lot of comments. I'm literally screaming. Oh, sorry, Anand, I thought you said I should be shouting. I'm speaking very loud, I hope. So yes, colleagues, that's basically just a note from me, and just to say thank you to all of the steering group members and Maaza for the hard work in really getting us to where we are today with this particular group. And we look forward to working with them in the next 2 years. They have a 2-year term of office along with the alternates. And of course, our first order of business will be to develop a call for proposals once the various streams of money comes in, and then have the happy job of independently reviewing proposals for the initial batch of sub-grants to advance the work of the Alliance on the continent. Thanks, Maaza. And sorry, everyone, my line is awful.
Okay, brilliant. Thank you for that, Tian. Oh, and I see Suhail has joined us. Welcome, welcome, Suhail. So yes, so I will be sending around a form shortly for the nomination. So we really want the wider PVA Alliance to be involved in nominating people who will serve as alternates. So people from various regions, we will do an initial review, and then the alternates will be voted on by anonymous vote by the steering group, Tian. I think that's what we have decided, correct?
Yes,
Yes.
for all
Okay.
steering group decisions, we'll use that online anonymous voting platform.
Okay. And so please keep your eyes peeled for that form. It's just going through review now for a nomination process for these individuals who will serve hopefully as alternates. Joab, I see that you have a question. Please go ahead.
Yeah, it will be useful that when you're sharing the nomination form, that you also include a terms of reference for the steering group. I'll also be interested in just understanding the role that the current members have played in shaping up PVA Africa, and if they have engaged in the conversations before.
Yes, and the terms of reference will definitely be linked to the nomination form, so you can see what will be expected of these individuals once they are nominated. Ooh, poor Jackie keeps dropping in and out. So all of these groups, and Tian, please chime in, two have been long-term members of the People's Vaccine Alliance. So IANASO and SAF-AIDS have been members, and all the others have been really active voices in terms of the COVID-19 response and vaccine equity. Tian, I don't know if there's anything that you want to add about that, in addition to just kind of the long-standing relationship that African Alliance has had with them and the respected work that they have in their various regions.
But I think one thing that might be helpful is, as we send out the call for alternates, we'll also include profiles of all of these partners, as well as make very clear links into their current and historical work, of course, not only with COVID, but in other disease areas.
Okay, great. And you will see the terms of reference, but just to highlight that, one, it is about helping to steer and guide the work of the People's Vaccine Alliance in Africa, but two, as Tian has highlighted, to make sure that decisions about funding are made in a transparent way. The People's Vaccine Alliance has set aside for the work in Africa for the next 2 years about $250,000. So that for the 2-year period will be used for campaigns, activities, small grants for different civil society organizations around the continent working on issues of COVID vaccine equity and rollout. Joab, I see your hand is still up. Did you want to ask a follow-up question? No?
Not really a follow-up, but it's just to challenge us a bit. Yeah, I understand that this is an update meeting, but it will be useful for us to also try to spare some time to think about strategy when a number of issues are being raised. For example, the issue of hesitancy, what Anand spoke about. How do we go ahead addressing such issues? I think I get a bit frustrated when we, for instance, African leaders are meeting in a week's time, then they will be meeting their counterparts in Europe in 2 or 3 weeks' time, and we don't discuss about it. The reason I was asking about the terms of reference of the steering committee, because I believe also they should play an active role in shaping the conversation, driving strategy. And so it's not just, for me, it's not just about funding, because yeah, African Alliance has gracefully been able to steer the People's Vaccine Alliance Africa without funding for the last couple of years, for a year, I think now. And it will be useful that we make use of these meetings a bit more strategic, use them for planning purposes, strategy development, and just thinking ahead on the new developments that are happening, Yeah.
Okay.
Yeah.
Thank you, Joab. I appreciate that. And we do have a section at the end of the agenda you saw where we are looking at activities that are coming up in Q1 or key events that are coming up in Q1 that I was hoping we could talk about a little bit here. And yes, just to echo what Tian is saying, yes, the development of the PVA Africa strategy. And secondly, what I would like to highlight to people here is, and I know that we repeat it at every meeting, and not everyone in this this monthly meeting is officially a PVA member. I would like to encourage all of you to consider joining the PVA officially. It's a very simple process. What happens is, we would link you to the coordinator of the People's Vaccine Alliance. She would send you the 5-point manifesto, ask you if you or your organization agrees, can stand by the 5-point manifesto, and ask you to declare any potential conflicts of interest. Once that happens, the process afterwards, yes, and you can join as an individual, Suhail, as well. There are some individuals that have joined the People's Vaccine Alliance. So once you join, and Joab, I know you're a very active member, you sit in the influentials team with me. There are some others. Charles sits in both the policy and advocacy group and the campaigns and media group. Once you join as a People's Vaccine Alliance member, then the various working groups are open to you. So then you can sit in the policy and advocacy group of the People's Vaccine Alliance and really shape those decisions and make sure that the African voice is there. Same thing with the campaigns and media group. Some of the activities that or the events that have been highlighted that I will show you for Q1 have basically been identified by the campaigns and media group. There's the AU-EU meeting coming up. There is the March 11th is the second anniversary of the official anniversary of the pandemic being announced. What does the People's Vaccine Alliance want to do in terms of campaigns? In the influentials team that Joab and I sit on, that's a team that really tries to target what the PVA refers to as influential people around the world. So not necessarily celebrities, but people who hold influence. If you've seen or if you remember some of the letters from last year, signed by Nobel leaders, signed by Gordon Brown, there's been a lot of outreach to African leaders as well. So it's really about deciding, making those decisions. So there's going to be a 2-level strategic planning. One is making sure that African voices are included in PVA Global. So I know that Flavia, I see you're here. Amnesty International is a very active member of the People's Vaccine Alliance and sits in several of those groups. And I really thank those of you who have pitched in and been involved already. So please consider that. And I agree with you, Joab. Hopefully we'll get to a point where we do better as we move forward in terms of not only doing updates at these meetings, but also discussing strategy. But please consider discussing those strategies at the PVA global level as well. Okay, so just moving on, Jackie has been really struggling on her phone today. So we're not going to do the bit about the membership information review. But what we also wanted to do, because I get in the emails that I send you a lot of bounce backs, a lot of not out of offices, but this email is no longer valid, etc. Jackie has created a very cool, sort of very simple form that will allow you online to go in and make sure that we have your correct information, and also to tick right there if you'd like to be kept on or removed from either the PVA Africa WhatsApp group or the PVA Africa email list. And also right there, be able to tick off and say, please do connect me to the People's Vaccine Alliance coordinator to join the People's Vaccine Alliance formally. So Jackie, if that's okay, initially I had hoped that Jackie could just show us how to use that form here. But I think given the fact that she has had to join on her phone, I think we'll leave that. It's a very simple form, but Jackie, I hope you don't mind if I volunteer you. Once you send it out, Jackie, if, for example, Anand, I'm going to pick on you. If Anand clicks on the link and says, this is really annoying, I can't figure out how to use it, if you can please put your phone number on the email that you send so people can WhatsApp you if they need help with the form. Is that okay, Jackie?
Yes, Maaza, that's fine with me.
Okay, great. Thank you. The other announcement, comrades, is that this is my last meeting with you as PVA Africa lead. I have been offered a position at PVA Global to help sort of try and coordinate their Global South work. So I say this with a heavy heart because obviously working with Tian is sort of the most exciting and exhausting thing anyone could imagine. So I've been trained, I've been sprinting through the last year. So hopefully joining PVA Global will seem easy after this. But as you have seen the job description going around, there is a job description going around for the PVA Africa work that I was doing, and also for the ABDA work that Tian has been leading to support that. So if you've seen that job description going around, that is the reason why. And we really, really would like people to either share the job description or apply if it's something that you'd be interested in. Tian, anything that you'd like to add about that?
Thanks, Maaza. I've been obviously just bittersweet to say goodbye to Maaza, but also happy that she will be remaining in the space and working closely with the African coordinator, with the new African coordinator that will get on board. So looking forward to seeing what that potentially brings. And yes, please do continue sharing and circulating the call for the new coordinator. We have a closing date of the 31st of this month, and of course it will go to an automated email address. So if anyone does apply and does not get immediate or personalized responses, please understand that at least in the South African context, it is irregular for us to engage with any applicants during the process. So please do encourage the sharing of that, and we look forward to introducing you to the new coordinator, hopefully by the next meeting. And I've just popped a link to the advert. Thanks, everyone.
Thank you. And as I said to Jackie, you know, I'm leaving the apartment building, but still staying in the neighborhood. So I look forward to continuing interactions with all of you. So thank you for that. So if there are any more questions about the steering group, PVA membership, I see some comments coming in, and we'll make sure to save all of those comments. If there are no questions about that, I'll just go to the activities for Q1 that PVA Global Calendar has identified. Any questions? No. Okay. All right. So I'm just going to pop up here. I hope everybody can see it. I've just pulled out the events that are in the PVA calendar at the moment for Q1. So here, something to keep in mind is that France has taken over the rotating presidency of the Council of the EU. The French president has really gone back and forth in terms of his support for the TRIPS waiver. So that's an individual and a country that the PVA is thinking about how to target, the same way Germany was targeted back a few months ago. There is a no patent film that was launched yesterday with a social media kit. If we have time at the end of this meeting, I'll share it with you. It's just about 1 minute and 20 seconds. If not, those of you who are on the PVA list will have seen this film. And by the way, colleagues, we have also set up a PVA Africa Twitter account, but you should also be following People's Vaccine because they do tend to share a lot of these things. Another event, that is coming up today actually is the Progressive International online event regarding Cuba and Cuba vaccine success. That's something that the PVA has also been kind of thinking about, how to deal with these non-Western vaccines and how to make sure we integrate them into the discussions. There's also a new vaccine that has come out of University in Texas in the US that is apparently going to be shared with no patent. So this is an event that, and Progressive International generally, not a member of the PVA, but very active, that the PVA has a good relationship with. There is a BBC Panorama documentary being scheduled to be released at the end of the month. So these are just the activities and the events that were on the PVA calendar. I wanted to highlight, Joab, the African Union Summit and also the AU-EU Summit. So again, for those of you who sit on the various groups at the PVA, you have heard PVA members saying, do we have enough time at this point to do something? Can we have an open letter? Is there a session being planned at either of these meetings that we can make sure we get some messaging in? Joab, I know that your group is quite active with the African Union. Anything you'd like to add here about the EU-AU Summit or the African Union Summit coming up? Joab, can you hear me? Has Joab dropped out? I have my screen share. So
sorry, Maaza, I didn't get your question.
So I was just saying, you know, these have just been added to the PVA calendar as events coming up in Q1 that we have to keep our eyes on. And within the various working groups, there's quite a bit of discussion at the moment of like what, you know, a lot of people only got back from the holidays, you know, in mid-January. Maybe some thinking should have been done, you know, at the end of last year about how we could target these. So is there, you know, there's talk in the influentials group, Joab, about is there an open letter that should be published at around this time? Is there a side meeting that can be held at this time? Is there an op-ed that we can, at short notice, get somebody high level to sign off to with the EU-AU summit? Is there a webinar that can be planned along with the EU-AU summit with somebody who can speak to some of these issues? So I just wanted to ask you, from your perspective with Christian Aid or with your former colleagues at Oxfam Pan-Africa, is there anything that you know that is being planned that we can pinpoint for these events?
Oh, yeah. This is what I was hoping we can be using part of these meetings for. So with the AU summit, there's quite a bit of uncertainties. Side events are closed at the AU premises. But beyond that, as Christian Aid, trying to coordinate a joint letter from civil society organizations, not just focusing on vaccines, but looking at peace and security on the continent, the COVID-19 and the whole recovery agenda. Vaccines fall on that, and then climate justice, some asks around climate justice. So hoping to get that different people are drafting different sections of that particular joint letter, and I'm coordinating that whole bit. We're hoping to get the incoming chair of the African Union, the president of Senegal, for a press conference where we'll hand over that letter. But with events banned at the AU premises, that's likely not to be possible. And so trying to work behind the scenes to get a 15 to 30 minutes bilateral meeting with the incoming chair with a few civil society representatives, then hand over that particular letter. So we're doing that, also targeting this one, but this one is almost confirmed, a bilateral with the AU Commissioner for Political Affairs and Peace and Security. Also working for the AU-EU summit, because we can't separate the two. For the AU-EU summit, we're looking to have a 2 days webinar on the 10th and 11th, looking at the different aspects of AU-EU partnerships, and health and vaccine justice will be one of the topics to be discussed. Still shaping the agenda, but health and vaccine justice will be one of the things that we'll be looking at and leading on as Christian Aid. We'll be doing this together with OSF Africa Regional Office and AfroDAD, but leading on different aspects of that webinar. Yeah.
Wow, that's great, Joab. So I would ask, if you have not already shared this information at the Influentials group or elsewhere, if you have sort of a concept note or anything, either you and I can, I'll be with you next week. Actually, the Influentials meeting is tomorrow, Joab. It's on Wednesday. Will you be joining the Influentials group at PVA on Wednesday?
Hopefully, yes.
Okay. If you are not able to join, please, if you have a paragraph or two that you can share with me, that would be great. And I can share those on your behalf. That's super exciting. This one too, you had talked about the open letter from civil society. Is that open? Can we sign it? Can the groups at this meeting sign it?
Yeah. Yeah, I've just I've just forwarded you an email I sent to a couple of CSOs. So I'll ensure that I include you in the next communication. Yeah.
Okay, so please do, and then I will update, this with any information that you can provide. That is really great. So these are, let me just scroll down. If anybody has events planned for any of these dates, please let me know. But as I scroll down, if there is something in February that we have missed, please also let me know so I can add it. And that way we can get it on the PVA calendar. And if you would like to organize something, even though the funds that are supposed to be coming directly to Africa have not yet arrived in bank accounts, I do think that PVA, Joab, you remember when your colleague Robert planned that day of action in Nairobi, there was a little bit of money available to support. So please do let us know if you have anything planned. Joab, while I have you, anything you'd like to say about the Christian Aid Equity Index? We have it here as to be confirmed for February.
Sorry, I was speaking while on mute. Yeah, we are hoping to launch the index in February. The dates will be confirmed. So the index is basically looking at how the G20, it looks to monitor the G20 members' contributions to vaccine equity, looking at different dimensions, for instance, the financing of vaccine distribution and COVID recovery, looking at how their pledges to COVAX facility, financing for international development as a percentage of GDP, SDRs, and how that's the percentage that is being recycled and to support vaccine access. Another dimension is looking at the control of vaccine production and distribution. So looking at the total share of the potential global vaccine supply that was procured by each of the G20 members relative to their share of the global population. So it's looking at the different aspects, how they're supporting the sharing of intellectual property. So those are some of the dimensions or some of the indicators that we're looking to rank the G20 countries on.
Great, thank you, Joab. So please keep us posted on that. Tian, can you speak about this Ports to Arms Africa Summit?
So Maaza, that's going to be a high-level summit, most likely to be held in Abuja. Of course, we will do hybrid, so there'll be virtual options, but it's going to be led by Ports to Arms, which is essentially the AVDA, the African Vaccine Delivery Alliance, the African Alliance, ourselves, in partnership with a few global partners, but will be attended at high level by both WHO leadership, Gavi leadership, and a range of key other players. We're just finalizing now a few details, but we'll be sharing the conference overview in due course. There will be a significant civil society presence and track. So we will be reaching out to all of you as well to get an idea of gauging interest from across the continent on who perhaps has some interest in participating in that conference through either leading sessions or sharing some of your work and calls to actions. So stay tuned. Stay tuned for that. It will be convened by the newly appointed special envoy to the ACT Accelerator, Dr. Yodela Kija, as well as the community engagement pillar of AVDA, which we lead. So more soon.
Great, thank you, Tian. I'm going to keep going down. I can't see hands coming up, so if you have questions, please just chime in. These, as I said, are just events that are on the PVA global calendar at the moment. So they're actually dates that are on the PVA Africa calendar at the moment. And then we have been going through and adding events. For these specific dates, it's really up to the People's Vaccine Alliance working groups to think about how to target them with campaigns or activities or op-eds or press releases. So it really is, you know, the various members chiming in and saying International Women's Day is a really important day to address certain issues. Let's spend some time on that. You know, so Tian, I was thinking as you were speaking about the statement from the, what did you referred to kind of the gender group in South Africa around menstruation. And, you know, that just made me think, would that be a day to kind of do some messaging in response to myths about vaccines and women, that sort of thing. So it really is sort of these various working groups are really kind of an open brainstorming opportunity. And usually the People's Vaccine Alliance allows people to take the lead on activities and provide support where it can. And I think I saw a hand pop up from you.
Yeah, Maaza, just an idea for that. We hosted a public discussion, an online one, where it was women and non-binary people who could speak and anyone could listen. But it was a really interesting thing. We were planning to do another one last week, but it fell through. But that might be an interesting thing to actually seed, is a lot of online discussions like that. We had some really great content. I can actually send you a recording of it if it's of interest as a model for what that could look like.
Yeah, please do, Anand, please do, because I think, and Suhail has sort of talked about this last year, this idea of doing different kinds of events, you know, listen in conversations, etc. So please, and as I keep saying, if you are interested in joining the PVA and being part of these working groups, please let me know. The one that I've put in red here is March 11th, which will be the 2-year anniversary of Dr. Tedros announcing COVID-19 as a pandemic. So various people in both policy and advocacy group and campaigns and media group have thought this would be an opportunity to have a global day of action around the pandemic anniversary. So I wanted to just see if anybody has this on their radar in their own countries. Is this an event that you think could take off globally? We've had some interest from groups in North America and in Asia to kind of try and lead a day of action around the 2nd anniversary. Any thoughts about this? No. Okay. So if they're not, I will just keep you posted, and Charles and Joab and others that are in the various working groups, I'm sure you'll hear more about this, and I will keep you posted. But the idea is to have a series of either online or offline events where there is possibility to gather offline to kind of have a look back and sort of make demands going forward at the 2nd anniversary of the pandemic declaration. So any important dates that you think this PVA calendar for Q1 is missing? You know, we've obviously added the South African, you know, Human Rights Day that we are aware of. There is the I had put here the Zero Discrimination Day, which I think Zero Discrimination Day, Tian, am I right that that originally started around HIV, but then became more broad, right? So the idea now is like all sorts of discrimination. Have we lost Tian? We might have. So anybody, any dates that you think are missing, I will send this list around. Any dates that you would like to add in your own countries, important days in Kenya, important days in Tunisia, anything that we can add that's missing on this list. I see something in the chat here, but I can't. Okay, I see Tian has chimed in. Great. All right. So, and Joab, I see that you've chimed in the Africa Regional Forum on Sustainable Development in Kigali. So I will make sure that I add that onto the list as well. Okay. So I am just looking at the agenda now. The last point that we had on the agenda, and I'm going to stop sharing before, and if we still have time at the end, I'm happy to show you that film and see what you think about it. It's a film developed by PVA. So the last point that we had on our agenda is the meetings that Africa CDC has been hosting with pharmaceutical companies. Some of you remember that Moderna had held a meeting last year at Africa CDC. Oh gosh. Sorry about that. Tian has dropped out, apparently. Hopefully Tian will join back in. So, so I don't know if you all have seen today, actually, and I got a few messages that a few people could not join our meeting today because they had to join the Johnson & Johnson session that was being hosted by the Africa CDC. There is a Moderna session being hosted next week. And I had a question from the PVA saying, does African civil society have concerns about Africa CDC co-hosting these meetings with pharmaceutical companies, especially a company like Moderna that has hardly given any vaccines to Africa, and is actually saying, I don't know, for those of you who saw, I'm sorry about this. I'm getting a weird, sorry guys. Tian, I think, has dropped off and is not able to hop back in. So I'm just getting a weird message from Tian, but I'll see if I can invite them to this meeting. So Flavia, I'm really curious if this is something that your team has discussed or anybody else. Charles, I know you sit in policy and advocacy. There is this issue about Africa CDC hosting these meetings with pharma. Recently, Winnie Byanyima, who is the co-chair of the People's Vaccine Alliance was on a panel with one of the Moderna leaders who was a lawyer. And that Moderna woman said, you know, Africa CDC has told us that they don't want our vaccines. They don't need them. And Winnie, you know, Byanyima came out and said that's absolutely not true. So there seems to be, you know, a concern about what is true, what is not true, and this concern about Africa CDC being quite, appearing to be quite cozy with pharmaceutical companies. So I got a request to say, you know, please ask African civil society reps what they think about this. Is this a concern, or is it really, you know, an issue of Africa CDC inviting these pharmaceutical companies to come and present their information the way they do to WHO and the way they would do elsewhere? Do you have any thoughts about this? Do you think some people are being overly sensitive about these meetings and the frustration of a group like Moderna being invited? And Joab, I think you and I maybe spoke about this last year when Moderna came to give that talk at Africa CDC in December about things like vaccines for adolescents and research, you know, boosters and, you know, vaccines for adolescents, things that were not even being provided by Moderna on the African continent. Any thoughts from anybody about this? Yes, Charles.
Yeah, so I was on the last call, I think it was in December as well, and it was actually quite chaotic from all the comments in the chat. But I think this is one of the, it's definitely unclear where exactly Africa CDC sits in terms of their relationship, because I think those meetings were presented as meetings for civil society, and a lot of data was presented, but data that was not, at least from my perspective, the thing that was odd was the data was not coming from the African region. So they were presenting all these data sort of, as you said, around boosters, clotting, all these things that sort of are very sort of well known in the European Western regions and sort of are key issues in those regions, but it wasn't quite sort of tailored to exactly what the situation is in Africa. So it was quite weird to have that presentation, and it didn't seem, I question exactly what purpose it served exactly. But, and I think it'll be good to get some sort of clarification from the wider sort of civil society group as well.
It's too bad that we lost Tian. Tian just sent a message saying that their network is too dodgy to join back. But given that Tian sits at ABDA, you know, I would be curious to hear what they think as well, and I will follow up. But is anybody else seeing any sensitivities around this, or do you feel, yes, Anand, I see your hand up.
Yeah, I mean, I listened to that discussion and it was uncomfortable, but I think I thought that was useful. I mean, Moderna is kind of one of the most outlying farmers, and in some ways it gave them enough rope to hang themselves with. And I think we do need to be building bridges at the moment. So having them in the space, even if it's uncomfortable, raises difficult, you know, questions and tensions. And thankfully, you know, Winnie was able to hold her own in that corner, but it was uncomfortable, but I think it needed to be. I think that wasn't a bad thing necessarily.
And that's discussion. And if the link is available, I'll send it around. But Anand, you're referring to the Winnie Moderna One campaign discussion earlier this week, right? Yeah. So if I have, and it's a very short conversation, I think it was probably not even an hour. So if I have access to the link, I will send it around. And I think, you know, if any of you have time, it would be worth having a listen. Okay. Yeah. And I do think, you know, the fact that the woman from Moderna said, Africa CDC has told us they don't want vaccines. And then for Winnie to be able to clearly come out and say, that is absolutely not true, I thought was really, it was quite a moment. Does anybody else have any thoughts about this? You know, hi, Ntando, welcome. Nice to see you, Ntando. It's been a while. So does anybody else have any thoughts about this, or should I just, you know, leave it and say that there are no, you know, it's about, they need to provide more information. There is a need for partnerships, but, you know, I think part of the reason why the first time around there was quite a bit of concern is that the invite that Africa CDC sent out for that Moderna meeting actually had the Moderna and Africa CDC logos sort of at the same level. It was sort of like Africa CDC and Moderna are one. They've now very wisely, for the second time around, changed it. It's an Africa CDC meeting with a Moderna presenter. So maybe they've also realized that the optics need to be revamped a little bit. But I'm seeing no very strong feelings about this, so I'll give feedback to the, and Charles, the person who brought this up was Moga, just FYI, who leads the policy and advocacy group. So she was in discussions with Africa CDC about this, and she, suggested that I bring it to the wider group to see if there were any thoughts. Okay, yes, Mlewa, I see your hand up.
Yes, thank you, Maaza. I was
that's Onesimus.
Saying that yes, I was just saying that I think I kind of concur with the rest, that in as much as there may be some uncomfortabilities, but it's always good to have the farmers in this space, so that that kind of interaction then brings the realization of what probably they are missing out and need to start actually considering, because the more they are actually out of the space, then they will continue probably doing the things that people really do not appreciate them for not doing. Thank you.
Great, thank you. If there are no other comments about this, I'll leave it open for any other business. We still have a few minutes remaining. If we don't use up the time, then I'll take just 1 minute, 30 seconds of your time to try and show you this new film that's been developed by the People's Vaccine Alliance that they're hoping that the membership can share. So any other business? Okay, so I will, and I hope that you can see this. I just wanted to get your thoughts on this film and ask that you do please share it on your networks. There is a social media kit that has been made available. Please, Jackie, let me know once I hit play if people are in the film.
There is no patent on rock and roll.
We can see it, Maaza.
Thank you.
No patent on greatness. No patent on democracy or the fight for change. No patent on doing the right thing. No patent on saving lives. Or is there? Unbelievably, there is. Hundreds of millions of people in poor countries still have no access to COVID vaccines, which are owned by big companies. We strongly believe that every human being has the right to get vaccinated against a potentially deadly disease. Because until every one of us is safe, no one is. Coming together and helping each other is what makes us human. If you feel the same, sign our petition and help us end the pandemic together as one people.
Hi, everyone. I hope you could hear. That's just a short film that the People's Vaccine Alliance has produced and that will be going out this week. And there is a social media kit associated with it. Any strong feelings about the film? I know that the last film that came out that featured Prince Harry, I got a lot of comments from people saying, why is Prince Harry featuring in a People's Vaccine Alliance film? And I know that some of you just decided not to retweet that one. I'm hoping that with the funding that is becoming available now, we will all be able to, develop our products in our own regions. At the moment, there's sometimes opportunity for feedback, and other times things happen at quick turnaround. So any initial thoughts on this short film? Yes, Marta, it will be translated to start with into French and Spanish. And then eventually, if people think it's useful, there's a hope to translate it into Portuguese and potentially other languages as well. Any thoughts?
Yeah, Maaza. When I first saw it, I think it's a good video overall, but at the very beginning, I didn't really make a connection to what it was about because it starts with that concept. And I just wonder, it doesn't hook me and grab me from the beginning. It looked like other content I might see. So that's just some feedback for maybe for future content.
Okay, thank you, thank you. And I do wonder, when I saw it, I wondered, is there some kind of in people's mind? I'd never heard that expression before. There's no patent on rock and roll, and I wonder if that's like an English thing or something. I'd never,
yeah, I didn't recognize that either, and it just didn't really click. It didn't, and I don't think it would speak to most of the audience that I know in Africa. So it was a bit odd, but I mean, these things are evolving, hopefully.
Yes, yes, and there is, and again, I hate to sound like a broken record, but please, please, if you are at all interested, please join the People's Vaccine Alliance in an official capacity. Jackie will be sending out that form that will allow us to update your information and also allow you to tick off right there if you would like the contact with the coordinator to join the PVA. And once you do that, you will be eligible to join the Campaigns and Media Group, Policy and Advocacy, where some of these materials and statements and strategies are developed. As we've said, once the money does appear, you know, each of the regions, Africa, but also Latin America and Asia, will be developing or have much more freedom to develop their own materials. And I'm hoping that at some point it will be like, you know, a film developed, you know, in Tanzania, which will be, you know, translated into English and used, you know, in the US or something like that. That would be really nice to see. So if there are no other comments, I think we can wrap it up for today. You get 4 minutes back. I just wanted to say that honestly, especially those of you who have really been stalwarts, I see that Vasi has dropped off, but she has attended almost every PVA Africa meeting. Charles, you've attended every single one since we first started them. Anand, you've also been super regular. Suhail, we've had so many communications over the last year. And obviously, Sophia and Onesimus, so thrilled to have you on the steering group. As I said, I'm leaving the building, but not the neighborhood. So please, please keep in touch. When I do have a new email address, I will share it with all of you. But yeah, it's really been a pleasure to try and engage with you over the last year. And thank you for all the energetic communications. And I really hope we can go forward and keep our energy to keep fighting this pandemic. Yeah, that's it from me.
Thank you, Maaza.
Thank you, Maaza.
Thank you, thank you, thank
and wish
you.
you all the best.
Thank you, thank you, thank you. All right. Hey, Ntando, nice to see you. We'll be in touch. Suhail, I've seen your note. I'm going to stay on, Suhail, just for a couple of minutes. Once everybody else signs off, you and I can have a chat. Bye, everyone.
Bye-bye.
Bye, Sophia. À bientôt. Bye, bye, bye.
Hi, Maaza.
Hi, Suhail. Let me stop the recording.
No problem.